So some of the fibrous tissue of the cortex was adhered to the lateral wall, so we had to remove all that. So this was the amount of such a high implant with multiple layers here. And you can see how depressed the nasal dorsum is. So we had to raise it significantly. Right, so this is, I think, 2 weeks post-op. Hello, my name is Dr. Hanjo Kim from A Plastic Surgery. We are a clinic located in the center of Gangnam District. Okay, so this patient had a very high dorsum with an implant, so the nasofrontal angle is not looking very natural. And you could see the margins of the implant, and that those were making it very unnatural as well. And the dorsum was very irregular. Alongside the tip was a bit short, and that's why it seemed like her upper lip was protruding a bit. Alar reduction scars were very visible. So it's very hard to remove and decrease the alar scars, so we decided to change the implant and try to extend the tip a bit. Okay, so going in surgery, there's a lot of scar tissue. We had to remove a lot of scar tissue. And the implant was Gore-Tex implant, so overall it's very adhesed to the tissue. And it's not common to use Gore-Tex here in Korea because of the side effects that it has. And after removal, you see that there's a severe depression of the dorsum because of the ingrowth of the tissue with the implant. Overall margins were not very natural. I think I changed it into a 3D printed implant. We'll see. So some of the fibrous tissue of the cortex was adhered to the lateral wall, so we had to remove all that. So this was the amount of such a high implant with multiple layers here. Right, so this is, I think, 2 weeks post-op. We did use a 3D printed implant. We projected the tip significantly with rib cartilage, and you see even with the swelling there's significant difference with the projection. So before any revision surgery, we always have to take a 3D CT to determine what kind of implants were used and what kind of materials were used for the tip and the dorsum. Because if this patient had previously used a silicone implant, then we can just opt to use a maybe 3D printed implant or change the dimensions of the implant. But since the patient used Gore-Tex, we have to be very careful because there is a lot of tissue ingrowth with the Gore-Tex implant. And with changing it to a silicone implant or even her own autologous tissue, there are a lot of determinant factors to make it a better nose. For example, if we use a silicone implant, we should maybe use a lower implant compared to the Gore-Tex. If we're using autologous tissue, we have to overcorrect it. So there's a lot of decision makings that we have to do when we're trying to do this kind of difficult secondary surgery. So this patient was very, very worried about surgery because she already had 2 surgical failures. And during the recovery period, nothing that I told her, she wouldn't believe anything that I'd say. Okay, it's 2 projections. There's a lot of swelling, is it infection? It's only been maybe 2 or 3 days, and she'd come in daily and ask these questions. And so I do get why where she's coming from. For example, let's say she had 2 previous marriages. One husband was very abusive. Second was never home. We just got married. I'm a very good guy, but because she had those previous, bad memories from the previous marriages, you can doubt how our marriage is going to be. But I'm confident in my surgical skills, and it's my responsibility to always address the issues that these patients have along the way. Although in some of the questions may be ridiculous, that's always my role to reassure the patient and feel that they're safe with these surgeries.